Welcome back, Straight Talkers. Today I'm going to talk about cyclothymic disorder and how psychiatrists go about making this diagnosis clinically. Cyclothymic disorder is listed under the section bipolar and related disorders in the DSM-5. The key feature of cyclothymic disorder is chronic, fluctuating mood disturbances involving numerous periods of hypomanic symptoms and periods of depressive symptoms that are distinct from each other. And it's thought that between 0.4 to 1% of the population has this disorder, and it's seen equally in males and females. Generally, we see symptoms start to develop in adolescence or early adult life, and in a small number of children who are thought to have cyclothymic disorder, the mean age of onset of symptoms is 6.5 years of age. There are 6 criteria that we psychiatrists take into consideration, and these are listed from A to F in the DSM-5. Criterion A states that for at least 2 years, there have been numerous periods with hypomanic symptoms that don't meet criteria for a hypomanic episode, and numerous periods of depressive symptoms that do not meet criteria for a major depressive episode. In children and adolescents, this only has to be a 1-year period. Criterion B notes that in the 2-year period in adults, or the 1-year period in children and adolescents, the hypomanic and depressive periods have been present for at least half of the time, and the individual has not been without the symptoms for more than 2 months at a time. Make sure you hit that subscribe button so that you can be the first to know when new content comes out. Criterion C states that the criteria for major depressive, manic, or hypomanic episodes have never been met. So when someone has been diagnosed with cyclothymic disorder, if at any point they experience a major depressive, manic, or hypomanic episode, the diagnosis of cyclothymic disorder is dropped and their diagnosis is changed to major depressive disorder or bipolar disorder, or whichever other diagnosis they meet criteria for. Criterion D notes that the symptoms in Criterion A are not better explained by schizoaffective disorder, schizophrenia, schizophreniform disorder, delusional disorder, or other specified or unspecified schizophrenia spectrum and other psychotic disorders. Criterion E states that the symptoms are not attributable to the physiological effects of a substance, such as alcohol, drugs, or medications, or another medical condition. And lastly, Criterion F states that the symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. If someone meets criteria for these various signs and symptoms, I will then specify whether or not anxious distress is present. When treating someone for cyclothymic disorder, I will always monitor for bipolar 1 and bipolar 2 disorder, as there's around a 15 to 50% risk that an individual with cyclothymic disorder will subsequently develop these other disorders. In addition, I'll always screen for substance use disorders, sleep disorders, and ADHD, as those with cyclothymic disorder are at higher risk of having these other disorders. Now head on over to the next video to find out more ways that you can live your best life.